Hello everyone, I'm Dr. Kirti Sabnis, infectious disease consultant from Fortis Group of Hospitals, Mumbai. As an infectious disease consultant, we thought I will discuss with you about the current infection problem which is facing country-wise. Actually, a lot of Southeast Asian countries also have the same problem. It's measles. Because measles is now not very commonly seen, it's like a forgotten disease. Everybody is aware and everybody is little scared about how it spreads and who is at risk and what all precautions to be taken. So we thought we will discuss about measles. Measles is it's a viral illness. It's a common illness in pediatric age group. Even though with a good vaccination, we see a lot of less cases. Last almost 15 to 20 years, we are seeing very less cases, and many of the countries in the world have actually eliminated measles with a good vaccination program. Unfortunately, India is still trying, and the coverage of vaccination is still not more than 90-95%. That's why we are not able to completely eliminate. So we keep on getting these small outbreaks in between. What is it? So it is a viral illness. It is a common cough and cold illness. So normally the presentations are a lot of conjunctivitis, rhinorrhea, fever, rash. Sometimes kids also complain about ulcers in the mouth. So these are the common features which it presents as. As you know, that viral illnesses, majority of the viral illnesses will have similar presentations like rash, body pain, redness of eyes. So it can be commonly missed as any other viral illness. That's why we thought we will discuss with you, because it is why it is important to know about measles. It's highly infectious disease. As you know, it spreads through fomites. What is your nasal secretions, your cough, your saliva can be infectious, and actually the infectious period can start up to actually 2 days before onset of your symptoms, and it can stay up to 3 days after onset of your symptoms. So total 7 to 8 days of infectious period, and it transmits rapidly to the other individuals. People who come into contact, almost 90 to 95% people get infected. If you see with same with COVID, if you want to compare, the infection rate of like a secondary attack rate of COVID was around 50 to 60%. It's much more infectious than COVID also. As it spreads through fomites, the particles can remain suspended in the air or in the surroundings for up to 2 hours. Still, it can transmit the infection. That's why it is very important to know what are the clinical features, and to avoid, if anybody is having these symptoms, we can avoid coming into contact. This is illness is mainly in the pediatric age group less than 5. Majority of the people get either vaccinated or they get measles infections by the age of 5. That's why above age of 5 we don't see a measles infection that commonly, as we see other infections like chicken pox or chicken pox is another similar infection which we see in adults also sometimes, but we don't see measles that commonly in adults. Many of the times it is been asked like why it is so important to know about measles. It's a childhood illness. So as I said, this is easily prevented by vaccination, and it can lead to a long-term sequelae. So, what are long-term? If somebody gets measles, what happens? So, majority of the people, up to we can say 70 to 80% of the people can get better by themselves. By symptomatic medicines, there is no definitive medicine for measles. Like we have measles for malaria, we have medicines for malaria, we have medicines for typhoid. So there is nothing like an antibiotic or antiviral, even which we have in some amount for COVID. There is no specific antiviral for measles, but it is mainly the symptomatic treatment. And but if it is treated and identified correctly initially, so we can avoid the complications. So what complications can happen? Actually, measles affects majority of the times your immunity. So people can get secondary infections, like they get pneumonias, they can get ear infections. Sometimes a long term sequelae can happen on the brain, which is not actually common, but yes, if it happens, it is generally non reversible. People can get convulsions, some kind of cognitive, like learning disabilities also kids can get. So it is, all these complications are easily preventable by taking vaccine. So it is very important to know about measles, educate our family, educate the other your neighbors, your relatives about measles, and encourage them to take vaccine about measles, because it is easily preventable by vaccination. So many a times I do get asked questions about vaccination, how to give, what is normal dose about vaccination. So measles vaccination is 2 doses. Generally, we start after age of 1 year, and repeat dose is given after 6 to 6 months, or 18 months. 12 months is the first dose, 12 to 15 months, and 18 months is the second dose. If an area is having lot of measles cases, sometimes we do give kids dose at 6 months. But kids who get a dose at 6 months for measles, it's an injection, and they need to repeat the dose after 1 year again, 1 year of life again, because your immunity is not that mature enough to form long term protection against measles if it is given too early in the life. That's why we need to give a repeat dose to form a solid immune response, immunity, and that's why we give it a repeat dose after 1 year. So, one dose of measles vaccine can prevent up to 95% or 90 to 95% of infections. If you get 2 doses of measles, the protection increases to up to 95 to 98, 99%. It's not 100% always. None of the vaccines in the world till can prevent you from getting any of the illness against which they are preventing 100%. So it is, but it is a very good immunity producing vaccine, and the immunity lasts for longer, almost lifelong. So it's very rare if you're vaccinated twice to get measles infection in your life. So it is easily preventable, can prevent many of the complications. And also it is important to know that although like we see bad outcomes like death, not very commonly in measles, but yes, with these complications of pneumonia, with complications of seizures, convulsions, fits, there can be, if you want to like number wise, 3 to 4 kids in 1,000 infected babies can actually succumb, can actually die with measles. So it is very important to give vaccines to our kids in correct timing. So this is about pediatrics, this is about kids, this is about giving vaccine, recognizing it earlier, preventing them from having contact if they have any symptoms like mainly conjunctivitis, oral ulcers, rash. We know now this as a basic information. बट हमें और भी बहुत पूछा जाता है कि बच्चों के सिवा और कोई रिस्क हो, किसी को रिस्क हो सकता है क्या? जनरली अब तक जो इन्फेक्शन हुए हैं वो सब इन्फेक्शंस अनवैक्सीनेटेड लोगों में हैं। तो ये सेकंड ग्रुप जो अगर और एक वल्नरेबल ग्रुप हम लोग बोल सकते हैं, दिस इज प्रेग्नेंट फीमेल्स, बिकॉज इनके वजह से बेबी को हो सकता है, और बेबी के आउटकम जैसे कि प्री मैच्योर डिलीवरी हो सकती है अगर मीजल्स प्रेगनेंसी में हुआ तो। अगर ब्रेस्ट फीडिंग के टाइम मीजल्स हुआ तो क्या प्रॉब्लम हो सकता है? तो मीजल्स अगर ब्रेस्ट फीडिंग के टाइम किसी भी फीमेल को होता है तो उनको वो मीजल्स बच्चे को ट्रांसमिट कर सकती है, और बच्चे का एज तभी लेस देन ऑब्वियसली 6 मंथ्स रहेगा, तो बच्चे के लिए कॉम्प्लिकेशन ज्यादा हो सकते हैं अगर तभी मीजल्स हुआ तो, क्योंकि तभी उनको वैक्सीन भी नहीं रहेगा। इसीलिए तभी हम लोग को ब्रेस्ट फीडिंग डेफिनेटली अवॉइड करना होगा। अगर कोई फीवर विथ रैश, टिपिकल कंजंक्टिविटिस, रेड आइज ऐसा कुछ है तो it is very important. Other group which is vulnerable for measles is pregnant and breastfeeding females. तो उन्होंने भी ये सब precautions लेने जरूरी है। Second question, third, fourth, a very important discussion I do get asked is because we hear a lot of pain and complications and possible side effects about vaccination. So how safe is the vaccination? Now we know कि vaccination is very good in preventing measles, but how safe it is? Vaccination के क्या क्या side effect हो सकते हैं? So vaccination is safe. It lot of studies we have about vaccination. They it doesn't cause any major problem in the kids. Fever related vaccine related fever can happen. Kids who are susceptible, sometimes kids are susceptible to have high fever and then convulsions, not very common, but side effects are very very rare than what effect or what protection the vaccine gives. So I think we should not think about the side effects when we are having such a good vaccine which gives long lasting immunity with only two doses. So vaccine side effects are very rare and mainly are local site related like pain, fever, swelling. So vaccine is safe. There were a lot of discussion and confusion and myths about measles vaccine causing cognitive problems in babies like autism, but this is only discussed. None of it has been proven. There is no link of measles vaccination with autism. So I will encourage everyone whosoever has kids between the age of 1 to 2 years, between 1 year completed and 2 year not yet finished, they should finish their two doses of measles vaccine. It is a very important vaccine in the childhood. It comes actually now as a combination like measles, mumps, and rubella. So three of the vaccines can be given in one shot together, and it is very economical vaccine. It is one of the free vaccines which is given by government of India as a important six vaccines of childhood. So if not you but anybody else around your surroundings, your mates who are working, they are not vaccinated their kids, please encourage them to go ahead and vaccinate. Do we have any comments or any questions? Can we vaccinate early in 6 months? We can't give the vaccine before 6 months actually. Anshu is asking about the same, but we can't give the vaccine before 6 months. Generally, the age of starting is 6 months and above. We don't give it before that because it will not work. And vaccine related, I was going to talk about that only. Vaccine related measles can it happens because as we know when we take flu vaccine there can be flu like symptoms, but actually how the vaccine work is they we inject actually a small dose of a virus or a bacteria which we are giving which we are going giving protection against, and body forms immunity, antibodies, rog pratikar shakti, what we call as, and then it works. So it can technically cause measles like illness if because it's a live vaccine, yes it can cause. So that's why we don't give it before 6 months of age. That's why the prevention and protection from suspected cases is very important. Mm, Somebody is asking about how effective the vaccine and what are complications. We have already discussed about how effective vaccine is. It is almost 90 to 95% in first dose and almost complete protection with two doses. Uh, I forgot the questions before. One second. We discussed about how we can identify measles early. We discussed what causes outbreaks. It's a very important question why we are discussing this all of a sudden, why this outbreak has happened. So this is not the first outbreak and this is not as bad it was as COVID, definitely. Because the age group also affecting is small and we majority of the people are vaccinated. This outbreak is mainly seen in unvaccinated kids. So, unvaccinated kids, if the population, as I said, to eliminate the disease from the community or from the country, like majority of the countries have eliminated measles already. So, we need at least 95 to 98% of the population vaccinated so that the spread will stop. So once the unvaccinated people, if they are more than 5 to 6% of the population, they will have the disease, and then they will transmit the disease to the susceptible population, like kids who have not been age reached up to the vaccination, like kids less than 1 year. They will transmit, and then the chain of transmission will continue. So the outbreak is mainly because of lack of proper vaccination. That's why we thought we will discuss this topic, which will give us the importance about timely vaccination for our kids. And also, vaccinations are not only important for kids, vaccinations are also important for uh, adults as well. Yes, we can. As Anshu is asking us, can we vaccinate at 6 months of age? Yes, we can vaccinate 6 months and above. But remember, because their T cell immunity is not much well developed, we need to give them a booster dose after they finish 1 year of their life. So we can give them as early as 6 months when there is an outbreak situation to control the spread. But anyway, the vaccine will take at least 15 to 20 days to act, to protect. In between, if they get any exposure, they can get, even if they are vaccinated with one dose, they can get this infection at that time, because first dose will give us only protection about 90 to 95%, not more than that. So we can vaccinate in an outbreak situation, but they will need a repeat vaccine. The complete answer for Anshu's question. Effects of measles of breastfeeding. As I already said, the breastfeeding female, if gets measles or measles-like illness, any viral illness, they can transmit it to the baby who is not vaccinated, and the problems can be sometimes life-threatening. If not always, but yes, as I said, 3 to 4% of the people is might get infection. So kids can get infection. So breastfeeding females, if they are suspected or confirmed to have measles, they need to keep they can't breastfeed the baby, not even the express milk, for at least how many days? At least until the viremia is complete, so at least 7 to 10 days minimum. Are you, is it? Yes. Okay. If any more questions are there, you can put it in the chat box. I think we answered majority of the questions which we're supposed to discuss. So, in a nutshell, yes, up till now, according to the government data, we have almost 9,000 cases of measles across the country noted. This is not a panic situation, because of the vaccination rates are good. We should be able to control the situation soon. And the answer to it is identifying early, isolating the cases, and there is no definitive treatment, obviously, for measles. Vaccination is the only solution to avoid these things again and again in India and across the world. Thank you.